All right. What I just got here, I have a patient that has potential closed tibial and fibular fracture. So first thing I'm going to do, I'm going to go and glove up, make sure I got my gloves on, and then we're going to go and assess everything. First thing I want to do, we can call EMS. Usually this is a procedure that most times EMS would do with vacuum splint. Next thing I want to do is I want to assess his pulse, if I can get to it, the most distal pulse below the fracture. He's got Chuck Taylors on, that's kind of tough, so I'd have to cut the laces so I can get to his dorsal pedal pulse and take that pulse. Next, we're going to go and check his, see if he can move his feet. Can you wiggle your toes? He's good, he can wiggle his toes. Can you feel this? All right, you can feel it. Next thing I'm going to do is I'm going to go and put on the vacuum splint. You can use just about anything to splint somebody though, whether it's some sticks you find in the woods because you're hiking or whatever. There's a million things you can use. So next thing, I'm going to go ahead and slide this underneath. Because it's a fracture of the bone, we want to make sure that we're going at the above and below joints. So, and you also want to leave room that you can still access the most distal part of the body, which is this foot here, so we can get to the pulse still. So we're going to unwrap them up. And with these, basically you take all the air out, and that's what creates the splint. So we hook up our pump. Always try to make sure it's on the right side. This one you put on the lower part, that's how it takes the air out. Alright, now that I got this nice and tight, I'm going to go back, I'm going to go ahead and check his pulse. Like I said, I would probably cut his shoe off, so I'm going to check his dorsal pedal. I'm going to also check to see if he can feel this, and can you wiggle your toes. All that's good, so we're set to go. Now we're just waiting on EMS for transport, and I'll go ahead and basically talk to my patient here, make sure he's good to go until EMS arrives, and I'll throw my gloves away in the proper receptacle.